Thanks everyone for having me. I love being in Miami. I got to tell you, we started in Israel. IATI, I think, was one of our first customers. We moved to Palo Alto. It took me forever to even get going with Stanford, and once moving to Miami, our ability to interact with healthcare systems here has been phenomenal. Today we work with institutions like University of Miami, Mayo Jacksonville, hopefully soon Cleveland Clinic here. So Miami has been really amazing to us. So I got a great job in building this ecosystem. IATI, thanks for organizing this conference here. My background, MD, PhD, originally from Israel. And today I lead a company called Theater, and the team there really dedicated to shining light in one of the last opaque areas within the healthcare system. Let's not view this as a pitch. I like this to be a bit educational for all of us because not everyone is going to be a physician, not everyone's going to be a surgeon, but most of us will have some kind of interaction with the world of surgery. And unfortunately, there's the status quo that the team at Theater is really positioned to tackle. And this is really the injustice that we're trying to solve for. You heard Wallach say before, to err is human. This is data coming out of Johns Hopkins. 1 in 3 individuals that undergo surgery today have some kind of avoidable medical issue and complication that arises from their procedure. And yet, when we look at healthcare systems and the world of surgery in particular, it's really the last silo of lack of transparency, which is kind of mind-boggling, especially since the operating room is also the profit sanctuary of any given healthcare system. I recently had a conversation with a VP at a large healthcare system that has over 250 operating rooms. And they positioned this question to me that you see here. How do we really know what the truth is in an operating room? Is it what the surgeon writes in their documentation? Is it what actually happens? Is it what is billed for? And sometimes we don't really know what the truth is. So that's exactly the issue and the problem that Theater and my team are tackling. And the thing is that we have everything right there. Surgical video is the ground truth of what actually happens in the operating room. And by routinely capturing and analyzing it, which is something that 95% of healthcare systems do not do today, we have the ability to really identify what the truth is, and from that derive various value for numerous stakeholders within the healthcare system. This value starts with individual, obviously the patients, individual surgeons, clinical leadership, and healthcare administration. What we've done at Theater the past several years is build really deep tech. We're deep tech and surgeons in this field. And 2 minutes. I can talk for hours, sorry. What we've built is deep tech capability by leveraging computer vision and proprietary LLMs over one of the largest data sets that we've created and accumulated from around the world in surgery. We are able to identify the key moments that have impact on your surgical procedure, and for the first time also connect the dots with outcomes to identify what works, what doesn't, best practices, and what to avoid. And by doing that, over hundreds of procedures across numerous specialties within the surgical world, we're able to have impact on a variety of workflows, starting by more accurate surgical documentation. We're all hearing in this world about ambient documentation outside in the clinic. Well, in a year or 2 from now, surgeons won't be documenting. Surgeons won't learn how to code for billing. Surgeons will be focusing on the main thing that they went to medical school for, and the higher cognitive function of actually providing better care for their patients inside the operating room. And so one of the first things that we're doing is automating documentation or automating surgical documentation from the OR so surgeons don't need to deal with that, for more accurate documentation and also for billing. And we're already seeing that we're able to increase charge capture per procedure by significant magnitude. The second thing that we're doing is we're modifying workflows around quality, safety, and operational efficiency. We've demonstrated with a variety of partners that we're able to improve quality of care, reduce the time that it takes to perform procedures through standardization and adoption of best practices. And the third thing that is also extremely important is bringing to the forefront of research a variety of publications that for the first time actually take a look at what happens in the operating room, which has really been sort of like very opaque. And I am done. Thank you. Happy to have a conversation afterwards.